Hi, welcome back to Talk of the Town. My next guest is Eric Hewitt from the Medicine Shop in Monona. Eric, welcome back.
Thank you for having me back.
Yeah, good to see you again. Yeah. So we're going to be talking a little bit about medication risks and special considerations for the elderly today. I'm wondering, are there more risks associated with giving medication to the elderly population?
There are, and there's a couple of reasons for that. As people age, their bodily systems kind of slow down, and there's, a couple of major systems that help break down medications in the body or get rid of medications out of the body. And those tend to be the liver and the kidneys, and again, over time, those things, kind of slow down, and it slows down the elimination of those medications. And when you slow that down, the drug levels stay in the body a little bit longer, maybe are a little bit higher, and then lead to the possibility of increased side effects or increased, longer effects when people are taking the medication at that age.
Yeah, and what are, in your experience, some of the more the biggest offenders, or the medicines that you see do this the most?
Yeah, there's definitely some classes that we have as pharmacists when we're dispensing to that population that we're a little bit more cognizant of and aware of. And those would be things like anti-anxiety medications, antidepressants, pain medications are often something that are all good medications to use for a lot of people, but they have to be used with extra caution because they have side effects of drowsiness or lightheadedness or dizziness, that kind of thing. So those are kind of main. There's also some blood pressure medications as well. All good things and not necessarily something to stay away from, but something that needs a little bit extra caution.
I'm curious, are there any sorts of medications or classes of medications that should be avoided completely then for the elderly?
I wouldn't say a blanket statement of, yes, you always should avoid this medication. Right. With all medications, there's going to be some benefits from the medication, obviously, while they're being prescribed, but there's also going to be some side effects associated with them. So it's always something to have a conversation with the doctor and with your pharmacist to say, why are we using this medication? Is this going to be the best medication for treating this thing? So to answer your question, blanket statement, is there something I should avoid? I would say no, but you have to have that conversation about risks and benefits.
Right. Now, some of our viewers might be using some of these medications or have family members that are using some of these medications. What are the best ways, what are some things that they can do to minimize the risks that are associated with using these types of classes of medication?
It's a great question. I think, first and foremost, having the patient or a patient's family member, if they're in charge of, a family member's medication, being their own advocate. So making sure when they go to the doctor and the doctor is saying, maybe we should try this medication, that you become, the advocate for yourself and say, okay, what am I taking? What are the potential side effects of that medication? What are things that I can do to, minimize those medication side effects, such as time of day that we're taking it, those types of things. So that's the major thing. And then also just making sure that you have that relationship with your doctor and your pharmacist to make sure that you can have that open dialogue if you do have questions when something like that comes up.
And I think that that's something that, until I got a little bit older and kind of understood a little bit more about how the healthcare system works, is that the pharmacist really is there to provide that information to people when they come to pick up their prescriptions. They don't just ask, do you have any questions about your prescription for fun? I mean, they really are knowledgeable on all of those things. And so, especially if it's something new, people can ask their pharmacist if they maybe didn't remember to ask their doctor or something.
Absolutely. I tell my patients all the time, that's what I went to school for. Right. That's what my other pharmacists went to school for. We didn't go to school to count out medications and be insurance experts or anything like that. I wanted to go to school to educate people about their medications and to improve their quality of life as it relates to medications. So you're exactly right. We love to do that. That's our profession. That's what we're meant to do.
Yeah, absolutely. So, there are some pharmacies that will offer medication reviews. Is that something that you guys do, and is that something that you think is beneficial in any way?
Absolutely. And that's, kind of where sometimes people are using multiple pharmacies, seeing multiple doctors. That the medicine shop does have a program where you can sit down, bring in all your medications, whether it's over-the-counter medications or prescription medications, herbal medications, and you can sit down and we sit there and go through those medications, make sure there's not any interactions, make sure that there's not any medications that may need to be changed, to get something that's more beneficial for you. So we do that, absolutely. You can always check with your pharmacy to see if they do something like that, because oftentimes that's a very beneficial service that pharmacies can provide for you.
Short of talking with your pharmacist, what are some things that viewers can do to find out more information about the risks associated with any medication they might be taking?
Now, a lot of people get those pamphlets just like, when you say the pharmacist asks, do you have any questions, and on their way. They're required to give medication inserts as well with the medications when they're dispensed. So those are going to have the side effects. So it's a good place to start to go over those types of things. And then again, having those conversations with your doctor, with your pharmacist, that type of thing. And then all of a sudden, oftentimes, coalitions of the aging and things like that have programs and classes to educate you about, minimizing risks and falls and that kind of thing. So you can check around with your community and stuff like that. A lot of times there's programs out there for that.
Eric Hewitt from the Medicine Shop of Monona, thank you so much for joining us today.
Thanks again for having me.
That's all the time we have for Talk of the Town. We'll see you next time.